Welcome back to the Factor Uncensored. According to the CDC, syphilis cases in newborns have skyrocketed. In the U.S., the numbers have surged more than tenfold in the last decade. My next guest shares why there has been such an alarming increase of the victimization of newborn babies. Sad story. Joining us now to talk about this disturbing statistic that we're seeing with syphilis in newborns, Dr. Danish Ali. First of all, let's establish, what is syphilis?
Isiah, syphilis is a bacterial infection that women get after a sexually transmitted disease where they may have had unprotected sex or a contact with another gentleman or an individual that may have syphilis, and it spreads. And what happens is that we've seen a tenfold increase in the cases of congenital syphilis, which is syphilis that is passed on to the baby inside in the womb of the woman. And what we see is that gets spread to the child, and that can cause higher rates of miscarriages, stillbirths, and other deformities that we're seeing as well.
Now, I'm sure if mothers knew they had syphilis, they wouldn't want to pass it on to their unborn child. So obviously they're not getting tested, they're having unprotected sex. What?
That's correct. All of the above, Isiah. So yes, the unprotected sex is there, and also they're not getting tested. And if they are getting tested, they may not get the appropriate treatment. This is a bacterial infection that's been around for many years, and there is a very good antibiotic, a medication that can help treat it. However, the problem is folks aren't getting tested. So therefore, if you are pregnant, one of the first things that your physician will do is to check to see if you have syphilis at your first prenatal visit. And if that's the case, then you will begin treatment for it, and you will be monitored accordingly.
Now, once a child is born with syphilis, how do you treat it in a child? And if it goes untreated in this child, that it has been passed down from mother to child, what happens to that child?
Right. So sometimes, and a lot of times, what we're seeing is that syphilis can be asymptomatic, meaning folks may not present with any symptoms, and so that's one of the reasons why they're not getting tested. And yes, it does spread. A lot of times, those kids turn out fine, and there's no issues, there's no any long-term effects. But again, with this higher number of cases of congenital syphilis, it is being equated to higher number of complications, right? Things that we've already talked about, the stillborn, being born at an early premature age, those sorts of things are what we're seeing, and that's why we're discussing it right now, so folks can get appropriately, first of all, diagnosed, and number two, get treated as well accordingly.
Now, this alert, this latest news came out from the Centers for Disease Control. What are they recommending that we do about this? Obviously, this is the highest number of newborns who are diagnosed with syphilis when they're born, 10 times what we saw back in 2012. So what are they recommending we do as a society to address this problem?
Yeah, so what they're recommending is to use condoms appropriately, or be in monogamous relationships as well. We've seen that numbers have increased with folks that don't use condoms, and also that are not in monogamous relationships. And so that's number one. Number two, get tested. There are very easy methods. There's even online, you can order things to your house and get tested for different STDs. You can visit your primary doctor and get tested. There are labs out there where you can go to, and without going through your insurance or even just paying self-pay, you can get tested and get results fast, especially if you've had that unprotected sex, or you've had sex with somebody you might not know if they have some sort of an STD or anything. So testing is very important, number one. Number two is the prevention that we've already talked about. And number three, treatment. This is something that can be treated very easily with antibiotics, and it can be monitored closely. So if you have any symptoms like those rashes or sores, painless sores on your body or genitals, those are all things that you want to get tested, and don't ignore those symptoms, Isiah.
All right, Dr. Danish Ali, sad statistic and just a horrible situation for newborns at no fault of their own. We want to thank you for this latest information. And of course, as you said, you should get tested if you think you may have syphilis. You don't want to pass it on to your newborn child. Absolutely not. Dr. Danish Ali, Arch Point Pain Institute, always good to see you, sir.